But fertility preservation is not just for cancer. The indications are growing. For example, chemotherapy is used in a number of non-cancer conditions. And there are radiotherapy treatments for the rare bone diseases that happen in the pelvis. When oophorectomies are needed for benign ovarian growth, hopefully not very frequently, or prophylactically for BRCA carriers or wide-bearing gonad. Also, we have had patients who were in the process of going through premature ovarian failure. You can catch these patients before they're plunged in, and you may be able to save some oocytes. Now, one of the significant treatments and transforming treatments they have in cancer is hematopoietic stem cell transplantation. But the problem in terms of fertility with this is they have to give very large doses of chemotherapy and sometimes total body radiation that wipes out the oocyte reserve, even in children. And if they do total body radiation, it can also damage their uterus. These women will have increased risk of pregnancy loss, preterm labor, if they receive total body radiation. So it affects the obstetrical outcome. And hematopoietic stem cell transplants are now used for a wide variety of hematological and metabolic conditions. Aplastic anemia, severe combined immunodeficiency, you can go down the list. And it's a magical treatment. It's actually the most classical example of stem cell therapy. Sometimes we ask, is there a practical stem cell treatment? Well, this has been around, that's what it is. But there's a price to pay. Now we extend this to, as I indicated earlier, Turner's girls. We're going to talk about this a little further. There are families with very strong history of early menopause, and these also are candidates for fertility preservation. We are now identifying numerous genetic or single gene disorders that are associated with early menopause, and this list will keep growing. And soon we'll be able to do a genetic profiling for women and give them an oocyte aging panel or profile, and say that, well, maybe you should preserve your ovarian function by this age or by that age. So that's not very, very far.